Children with Special Needs by Mary Guyton-Baker. Today, the presentation will cover definitions, statistics, maltreatment, risk factors, issues facing families, and working with special needs children. What is special needs? The term special needs is used to define those that require assistance due to physical, mental, behavioral, or medical disabilities or delays. Children with special needs may have mild learning disabilities or profound cognitive impairment, food allergies or terminal illnesses, developmental delays that catch up quickly or remain, occasional panic attacks, or serious psychiatric problems. The term is used in clinical diagnosis as well as fundamental and educational settings, and is useful for getting needed services, setting appropriate goals, and gaining an understanding for a child and a family. Disability is defined in federal law by the Individuals with Disabilities Education Act, or IDEA. The term child with a disability means a child with hearing, speech, visual, orthopedic, or other health impairments, mental retardation, serious emotional disturbance, autism, traumatic brain injury, or specific learning disabilities that require special education and related services. Maltreatment refers to child abuse and neglect and means any recent act or failure to act on the part of the parent or caretaker which results in death, serious physical or emotional harm, sexual abuse or exploitation, or any act or failure to act which presents an imminent risk of serious harm. Now let's look at the statistics. In 2010, there were 53.9 million children ages 5 to 17 in the public education system. Approximately 5.2% were reported to have a disability, according to the U.S. Census Bureau. In 2012, 36% of all children and youth receiving special education services had specific learning disabilities. 21% had speech and language impairments, and 12% had other health impairments. Students with autism, intellectual disabilities, developmental delay, and emotional disturbances were each 6 to 7%. All other impairments each accounted for 2% or less, and the categories that were less than 1% are not shown on the graph. Also, in school year 2012, the number of children and youth ages 3 to 21 who were served under IDEA was highest among the category of American Indians, Alaska Natives, and African Americans, and least among Pacific Islanders and Asians. Now let's look at maltreatment of children with disabilities. In 2009, there were 9.3 new victims of child maltreatment per 1,000 children in the population. 11% of those victims had a reported disability. Children with disabilities were 1.68 times more likely to experience abuse or neglect than children without a disability. Children with disabilities had overall lower rates of maltreatment compared to the general population, but were 1.5 times more likely to be seriously harmed by the abuse or neglect they experienced. A multi-state analysis of repeated child abuse victimization found that children with a disability were 1.5 times more likely to continue to experience maltreatment 2 years after their first offense. This analysis found children with disabilities are more likely to be neglected, not abused, than children without disabilities. There are a number of risk factors that place children with disabilities at risk for abuse or neglect. First, let's look at societal factors. When children with disabilities are separated from their peers, it makes them seem different and unworthy of the same social and educational opportunities. By devaluing the contributions of children with disabilities to society, it becomes more acceptable to treat them poorly or use violence. The belief that caregivers would never harm children with disabilities results in a lack of attention to the problem. When children with disabilities are viewed as asexual, it may lead caregivers to deny them sex education that could help prevent abuse. By believing some children with disabilities do not feel pain, unnecessarily harmful therapies may be used. Children with disabilities who internalize the above societal attitudes may feel shame or feel less worthy of being treated respectfully. And the lack of training impacts the ability of social workers, teachers, and other professionals to identify and report suspected maltreatment of children with disabilities. The following risk factors summarize issues related to the family's reaction to the child with a disability and the parent's knowledge and skill to care for the child. The family views the child as different, sees a disability as an embarrassment, or mourns the loss of a normal child. The parent lacks the skills, resources, or support to respond to the child's special need and provide adequate care or supervision. The parent is unaware his or her child with disabilities is at greater risk of maltreatment and may be unprepared to identify and protect the child from risky situations. The parent of a child who exhibits challenging behaviors may be more likely to exert unnecessary control or use physical punishment. The parent of a child with disabilities who is unresponsive, unaffectionate, or exhibit behavioral problems may have difficulty forming a strong attachment with the child. Frequent hospitalization may also weaken the parent-child attachment. And the cost of ongoing treatment or care for a child with disabilities may put a financial strain on the family or affect parental job stability. There are numerous risk factors for maltreatment that address characteristics of the child with a disability. Most of them relate to the way individuals respond or care for children with disabilities. Although children are not responsible for being victims of maltreatment, these factors listed here place them at greater risk. Although maltreatment is most often perpetrated by family members, children with disabilities are also at risk when they are cared for by others. The risk factors are an abusive subculture that allows for extreme power and control inequities between caregivers and children, dehumanization and detachment from the children, clustering vulnerable children with others who might harm them, and tolerating inappropriate behavior among children, isolating children or allowing little to no outside contact, and lack of procedures for reporting abuse and monitoring investigations of abuse. Now let's look at the issues facing families: divorce and single parenting. Among the 12.5 million single female-led households, 34.8% reported one or more members with a disability, compared to 27.3% among married couple families and 31.6% among single male-led families. Divorce following the birth of a child with special needs has been cited as the primary factor leading to single mother-headed households for families with a child with special needs. 53% of parents caring for a child with a disability believed the situation had caused either some difficulty, major difficulty, or the breakdown of the marital relationship. Financial struggles. According to the U.S. Census in 2000, most families with a special needs child live one socioeconomic level lower than their counterparts without a special needs child. Families raising children with a disability had a median income of approximately $38,000 compared to approximately $49,000 for all other families raising children. Nearly 24% of families with special needs children chose to cut back or stop working in order to care for them. Among families with one or more members with a disability, the poverty rate was 12.8% and 7.7% for families without disabled members. In every state and the District of Columbia, the poverty rate was higher among families with members with a disability than families without. Now, working with special needs children, what must we do? We must understand family life, appreciate and respect the extra work it takes for families to care for children with special needs. Communicate with families. Ongoing two-way communication is key in working successfully with families of children with disabilities. Schedule a meeting with the children's parents prior to the child's start in your program. Get to know each child and find out as much as possible about the child and the family. Tell the parents how your program is designed to meet individual child's needs. Provide a simple questionnaire for the family to specify important information about the child's likes, dislikes, personality traits, skills, special health needs, or medications, and emergency contacts. Learn about the disability. You may be familiar with a particular disability, but not the specific manifestations in a particular child. The child's family may be the best source of information. Work with challenging situations. For example, when working with families of children with special needs, you may encounter parents who appear angry, confrontational, mistrustful, or question your methods. Do not take this personally, but do extend grace. Do not fear or worry about having a child with special needs in your care. See the whole child, not just the impairment. And be a teammate with families and support the cause. This is the conclusion of this presentation on children with special needs. And remember, they are just kids too.